Hi, I am a student at the Universidad Católica Santiago de Guayaquil. My name is José Antonio Barragán and my topic is Schistosomiasis complications and my three social networks. Definition: disease caused by parasite freshwater worms found in certain tropical and subtropical countries. The parasites can be found in sub-Saharan Africa, the Middle East, Southeast Asia, and Caribbean. Drinking water is contaminated with the urine or feces of an infected animal or human.
And it's a relatively recent phenomenon that we've realized just how much the female genital system has been involved as a result of adolescent and even younger girls getting infected with urogenital schistosomiasis, schistosoma hematobium. And as that infection has proceeded over the years, eggs from the worms that have supposedly left the human body in the urine, having gone through the bladder, have actually ended up in the cervix. Now, the result of that is that eggs in the cervix have resulted in lesions. Now, HIV has to get inside the human body, and these lesions on the cervix act as an open door. Adolescent girls in many parts of Africa, unfortunately and sadly, have their first sexual experience with older men, and many of those older men may be infected with HIV. In a number of different countries, specifically Malawi, Tanzania, and Mozambique in particular, where the prevalence of schistosoma hematobium is much higher than expected and than usual, so too is the prevalence of HIV in young ladies. And therefore, the assumption is that there is that link which I have described.
For me, schistosomiasis is not only a parasitic disease. It starts with a parasite, but then it develops into chronic morbidities. One consequence is female genital schistosomiasis. It's, in my opinion, completely underestimated. It results in a gynecological disease. It's definitely women suffering from FGS are at very high risk to get HIV. Most women are not even aware that they have female genital schisto. They suffer from symptoms they don't want to talk about. Yeah, they suffer from bleeding, even from infertility. It's stigmatized, and you are not going to see a doctor and explain what's happening. Plus, then you have the fact that you have areas where you have 5 times higher HIV incidence, where you have hematobium infections. So for most of us, it's very clear what's going on, but absolutely, how to explain to women that there's HIV as a high risk when you even do not know that we are talking about schistosomiasis.
We have to be proactive. Those girls often don't know they're infected. They're almost certainly in the rural poor populations, and therefore they don't have access to medicines. They certainly don't have the money to purchase them. But we, using donated praziquantel, can reach out to those children, initially at school, but also what's more important is the girls who are not at school, because of all the population group that have the lowest attendance at school, it's 8, 9, and 10-year-old girls. And so we've got to go out into the population. We've got to be proactive.
It's not understood so far by the HIV community. They have very ambitious goals to have 0 new infections by 2030. Yeah. But you can only achieve it if you understand all your factors that are contributing. And for me, FGS is an important factor that is not well known in the HIV community. Don't see us us as the parasitologists on the other side of the fence include us. Yeah, when we discuss FGS with the schisto community, there's always agreement. You know, everybody understands what we are talking about. Invite us into a dialogue, and it started. So I'm not saying it's not happening. It started. It's slow, but we need to get there.
We have 10 million girls who would qualify for treatment, and Peter Hotez, who is the editor of PLOS NTDs, has on a number of occasions, and I've actually co-authored with him, published papers saying that we actually could make a stab at prevention of HIV for only the cost of treatment with praziquantel. For 30 pence, we can provide young girls with a treatment for schistosomiasis before any lesions have developed. And the assumption is, and I think it's a very fair assumption, that we'll close the door to HIV infection when they have their sexual experiences.
Application in medicine. In experimental schistosomiasis infection, the typical X granuloma reach its a maximum size by 4 to 8 days. However, total removal of residual X shields requires at least 3 months and, if calcifies, probably years. Accordingly, the anatomical and functional abnormalities etched by granuloma and subsequent scar formation should extend over a similar period of time. In fact, pros and cons. There are no advantages of parasitic disease. Genital manifestation has been neglected as a disease entirely during a period when a considerable progress has been achieved in the diagnosis and management of other disease complications such as liver fibrosis.
Scientists who study the neglected tropical disease schistosomiasis are relying on the National Institute of Allergy and Infectious Diseases, or NIAID, for an unusual research resource: snails. By providing this resource to scientists free of charge for use in their experiments, NIAID is helping scientists save money and combat a disease that is ravaging the developing world.
This is a disease that does not grab the headlines very much. It's a neglected disease. It infects the poorest of the poor. And we just think it's a worthwhile thing to look at. It causes so many problems. And it predisposes people in the poorest countries to other infections as well.
According to the World Health Organization, at least 200 million people worldwide have schistosomiasis, and more than 700 million people live in endemic areas. The cause? Parasitic worms, which contaminate fresh water across the globe, primarily in Africa, but also South America, the Caribbean, parts of Asia, and the Middle East. When people come into contact with contaminated water, the worms burrow into people's skin and make their way to blood vessels in the liver, intestines, or bladder. There, the worms can live for years, producing thousands of eggs that build up in the body and cause serious pain and internal scarring. Currently, no vaccines exist to prevent schistosomiasis. There are drugs available, but they can't prevent reinfection. For scientists to tackle schistosomiasis, then, they must learn more about the parasites that cause the disease and their complex life cycles. What they know already might surprise you. Before the worms ever make it inside humans to lay eggs, they must first spend time maturing in an intermediate host. In this case, specific species of snails. Studying the parasites in snails could yield possible interventions to stop the disease.
If we can look at the molecular interaction of this parasite in the snail, we might actually be able to translate that to how we relate to the parasite ourselves.
But maintaining colonies of snails for use in experiments is no easy task. That's where NIAID's Schistosomiasis Resource Center comes in.
The problem is, if investigators want to actually look at different stages of the disease or the parasite, they would have to maintain the entire operation in their own lab, which is not only expensive to maintain, but you also need a certain amount of technical expertise that not every lab has. And so back in the 60s, the NIH had the foresight to fund a contract so that these life cycle stages could be maintained, so that researchers can actually tap into that without maintaining these life cycle stages in their own labs. So by doing that, they're able to use those research dollars in other ways.
The Schistosomiasis Resource Center supports 90 labs around the world by providing supplies and training, and researchers depend heavily on that support. Last year, the center sent out about 45,000 snails to researchers for use in experiments. And since its founding, the center has made possible thousands of publications on schistosomiasis research. Scientists use resources from the center for a variety of experiments. Some scientists are working to develop vaccines or better drugs to prevent or treat infections in people. Other scientists are focused on blocking transmission of the parasite in the snail so that it never reaches humans in the first place. Ultimately, a combination of approaches may be most effective in solving the problem.
People are looking at various places around the cycle to break it. That's why people are interested in treating people. If all the people were treated, okay, no eggs would be contaminating the environment. Okay, if all the snails were killed in an area, they could not transmit it. So it's research into all of these various phases that may be important, and it may be a combination of these that eventually reduces it.
But for some people, the most intriguing research questions about schistosomiasis are the most basic ones.
Why are there parasites? What makes them parasites? What are their basic needs and why do they exist? To me, you can't separate it from entire, the biological question here. It's precisely the big question and the most interesting question. And if we can understand that, can you imagine? Rid the world of these parasites for good?
In the meantime, the Schistosomiasis Resource Center continues to supply critical resources to the scientific community and help new researchers enter the field. Increasingly, researchers are recognizing that schistome infections share symptoms of many other diseases too, and that basic research discoveries about schistome infections may have important crossover applications for asthma, fibrosis, and other conditions as well. For more information about schistosomiasis research and other research resources at NIAID, visit www.niaid.nih.gov. For Eye on NIH, this is Katie Rush.
Issue applied in Ecuador. In patients whose records has been published, the natural history has been interrupted as surgical intervention, which in the case impressively cites pelvic tumors or putative malignant Nantes orange seems to be justified.
Mademba, Mala, and Mamegora are just 3 of more than 200 million people in Africa suffering from schistosomiasis. The neglected tropical disease is triggered by parasitic worms, whose larvae are widely found in lakes and other stagnant bodies of water. Children in particular become infected with the disease. When playing in water, they are an easy target. Malnutrition, anemia, a lack of concentration and stunted growth. The infection also often leads to death. Since 2007, Merck has been supporting the World Health Organization, WHO, in the fight against schistosomiasis. The company donates praziquantel tablets to WHO, which are then distributed at schools. This is to especially protect those who suffer most from the consequences of the disease. However, providing tablets is only part of the solution. Merck therefore supports an education program with the aim of preventing children from coming into contact with the dangerous parasites at all. At school, the children learn how the disease is transmitted and which bodies of water they should avoid. In addition, within the scope of a private-public partnership, experts at Merck are conducting research on a pediatric formulation of praziquantel. At the end of 2014, Merck initiated the Global Schistosomiasis Alliance, together with other partners. The ambitious goal is to eliminate the worm disease across Africa and worldwide.
Conclusion. The migrating worms are actually responsible for the deposition of eggs in ectopic organ rather than a mere embolization of passively transported eggs to aberrant sites is clearly evidence.
When it comes to diagnosis, presence of schistosomal eggs in stool for all species, or urine for S. hematobium, under light microscopy is the most reliable diagnostic test. Moreover, direct visualization of the eggs allows for identification of the species causing infection through morphologic differences in the spines and the sizes of the eggs. However, the sensitivity of this method is limited in early infection and when the intensity of infection is low. Colonoscopy and cystoscopy have greater sensitivity but are more invasive when compared to microscopy. Therefore, these methods are reserved for cases when the diagnosis is suspected but microscopy is negative. Demonstration of eggs within the tissues on biopsy of the rectum, intestines, or bladder would be diagnostic of schistosomiasis. In the lower image, S. mansoni is visualized in the intestinal wall on colonoscopy. Serologic testing is both sensitive, greater than 90%, and specific, greater than 95%, but cannot be used to distinguish between prior and active infection. Therefore, serologic testing is only useful for ruling in schistosomiasis in travelers who have had no prior exposures to the parasite, and for ruling out schistosomiasis in endemic populations. Of note, the sensitivity and specificity is limited in early infection given that seroconversion generally does not occur for 4 to 8 weeks. Lastly, radiographic imaging is helpful in established disease and can identify complications of chronic infection. For example, radiographic imaging is useful in cases of S. hematobium with urinary tract involvement to visualize granulomas within the bladder wall, bladder cancer, and hydronephrosis. It can also assist in cases of S. mansoni and S. japonicum with liver involvement to visualize fibrosis, hepatosplenomegaly, and ascites. A radiograph of the bladder shows curvilinear calcification in the bladder wall, indicated by the arrowheads, with extension to the distal left ureter, indicated by the arrows, consistent with an abundance of calcified eggs typically seen in chronic infection.
Thank you very much.